Let's hear from Emma Mulvaney-Stanak from the Vermont Workers Center.
And I'm going to stand up because my day job is also to be a labor organizer for Vermont NEA, and I know it's afternoon, so I just want to make sure you all hear the Vermont story and stay awake and engaged. So I have to actually thank Travin for putting me up to this. Though I volunteer for the Vermont Workers Center, I am not a staff member there, and Travin said something about young faces of the labor movement or something like that. So if I make up factoids, you can check out the Workers Center. Workerscenter.org is their website, but hopefully I have been involved in the campaign and can represent it well. A couple of the main themes. The Workers Center in Vermont was founded in the mid-90s. It is now an affiliate of Jobs with Justice. And it really is, in my mind, working inside a labor union, the great alternative for both creativity and some freedom to really push the labor movement in Vermont in the direction it needs to go. There's only so much you can do within the rank and file and the leadership systems and all of that within organized labor, in my opinion. So the Workers Center has really pushed on a lot of issues like livable wage and whatnot, but 2 years ago decided that creating a campaign called Healthcare as a Human Right was the way to go for Vermont. You might think Vermont is all this progressive politics and great people and whatnot, but when you live in it, we aren't necessarily that much further ahead than the rest of the country. But we decided that if change was going to happen, we needed to do it on a state level in Vermont and attempt to do that first in Vermont. You might have all heard of Howard Dean from our state. We don't really think he's the most progressive guy in the world, but he was actually in leadership when we started doing some initial changes in Vermont to expand basically our income-sensitive state-based health insurance programs, but did not clearly go far enough. We did cover all kids under age 18 through a program called Dr. Dinosaur, and things died down. It's like this ebb and flow of healthcare reform. A couple years ago, we also tried this Cat and Out program that expanded the program a little bit more, but it never really addressed universal coverage, nor the underinsured issue, nor the fact that those of us, even with insurance, are paying these gross, insane amounts of money for copay, and bargaining tables are not getting any easier in terms of bargaining copays. So the Workers Center has been working on this for about 2 years, and the main thrust of this campaign is that they brought it to a moral issue. They define this as a moral issue, that healthcare is not a system, it's not a policy, it's a human right. And one of the main themes around that is organizing around 5 principles that any healthcare system that we were actually going to get behind, we meaning the Workers Center and the movement, had to include these 5 principles. It had to be universal, it had to have equity, there needed to be accountability in terms of the system being accountable to the people in the system, transparency of government, and participation by all. And then nothing that did not include those 5 principles, that would not be sufficient. So rather than looking at it as a market-based system that would be solutions found there, it was really a system that needed to be single-payer and moving in that direction based on this moral push. So like any good organizing campaign, they start with many tactics, and it's about as grassroots as it gets, because the great thing, again, about the Vermont Workers Center is it rallies a lot of people who have no unions. They have no voice within their union because they don't have a union. But it also reached out to organized labor at various steps along the way. So the first thing that they did, and I actually remember them doing this in Vermont, they went around and I don't even know how many surveys, Travis, you even collected, but
it was over 1,200.
1,200 surveys, which is a lot in Vermont. I mean, we're only 600,000 people. We have more cows than people in our state. So they went around and had surveys collected, and the surveys were, I don't have any examples of it, but I'm sure it's on the website. They were collecting surveys of people's own experience with healthcare. And along with this moral theme, a lot of these tactics kept tying back to people's personal horror stories around healthcare to define the crisis. Because I'm sure that if you surveyed your local leadership within policymakers, a lot of these people have health coverage. They may know a couple people who don't have health coverage, but they themselves don't often have that experience. So the survey started collecting that information. Then they held a whole series of local human rights hearings where they brought local leaders who were a mix of faith leaders, local politicians, local labor leaders, and they all sat up on these panels, and they had their own community members come through and testify to this local panel what it was like not having health insurance or paying too much, or all of these stories that you all, I'm sure, have heard out in the field. So they did these all over the state. We had 14 counties. I'm sure they did at least 14 of these hearings all over the state just to create this groundswell that something's happening. People are starting to talk about healthcare. Then on May 1st of last year, May Day, there was the largest rally in Vermont history. I was going to say U.S. history. It is on the Vermont level. Vermont history. On a weekday, we had 1,000 people turn out, which again is huge for Vermont. And marched on the State House lawn. It was a big to-do. The State House was, the state legislature was still in session. We're only part-time, so they were about to get out of session. And they really built a lot of visibility around this campaign is going somewhere. There's some momentum going. Some of you might have heard of our senator, Senator Bernie Sanders. Thank you. I can take personal credit. No, not really. But Senator Sanders, he's a big ally in the labor movement, of course, especially in Vermont. He helped do a series of summer town meetings. Town meetings is an essential part of our local government. You can all look up Vermont later on to find out more about that. But he helped us generate a lot of turnout over the summer for people continuing to come off of that May 1st big rally to continue to talk about health care, pushing towards the next session, because our legislature breaks from May to January. So we have that whole window of time to continue to organize. So we did all of these town meeting forums. We also went out to all the unions to get endorsements. My union, Vermont NEA, finally endorsed and got on board, which was pretty radical considering, again, we're going off this moral imperative, and at least for teachers and support staff, we have our own little safe little system. And to rock the boat a little bit, going off this moral theme really helped our leadership, I can tell you from inside, finally get on board with saying, yes, we support and endorse this campaign. If it was a specific bill, it may have been harder for our union to sign on. So that moral element made some room for the comfort level of the higher-ups, or higher than my pay grade. So, we wrapped up just a couple more tactics, because I think these are effective. We then wrapped up the end of 2009 with legislative accountability sessions, essentially. We invited legislators, before they were going back to session, to come to another series of hearings all over the state. And the great thing about that was that they all followed the same exact format. I'm sure if you went to each one, it seemed like you're in Groundhog's Day, because everything looked exactly the same. But the same set of local representatives from that county would sit up. People from the community would testify, an organized series. And then they would ask them about the 5 principles I mentioned. And then everyone was asked yes or no, all the legislators, if you would support the Healthcare as a Human Right campaign. Yes or no. They weren't allowed to give long, winded answers about, oh, it's really complicated and funding and all of that. It was just straight up yes or no. And at least the couple that I attended, every single legislator, despite their party, said yes, that they would support healthcare as a human right. January, they held a huge hearing once the State House came back into session. The chair of the Senate Healthcare Committee actually organized a hearing, which I think was the direct result of all this groundswell that was happening in 2009. It filled the well of our house, of our state house, and people came out and testified. There were probably, I don't know, a dozen in opposition, but dozens in support of trying to do some real reform in Vermont. So to fast forward, I don't think I probably have that much time to show you a video, but it's up on the Workers Center website. It encapsulates this entire campaign. It will show you a lot of imagery, really compelling stories, but also some more tactics that the Workers Center was able to do. And we're rounding it out by having another large rally, hopefully larger than the first one, again on May Day, so in a couple weeks. If you're around Vermont, come on over. It's actually, there's no more snow, believe it or not. You should come visit. And trying to really kind of continue to push. And the update on the legislative front is that there were 2 bills introduced in the beginning of January. And now S88 is the one who got legs and moved. And in this bill, and it just passed yesterday from the House, I believe, in 3rd reading. In this bill, there's some really important components. While it doesn't establish a system that's going to be created as of July, it creates a commission that is instructed that by February 1st of next year, they have to come back with at least three systems that they've thought out and designed. One including a single-payer system that's government funded, and a schedule about how to get there with actual timelines and a framework. And that this commission includes legislators, but it also includes healthcare experts, none of which can be from an insurance company or from a healthcare provider. So it really is an attempt, at least, to have some real brains in the room, but not people who are obviously biased one way or the other. And let's see, what else about that? So that's S88. Of course, between now and whenever this commission brings that back, there's a big thing called the elections in November. So we'll see if those same people are there or not, and if they hold true to that. We also are electing a governor for the first time in 8 years. We have had a Republican. He could veto this. He's still in power until November. So it's going to be a lot of moving parts between now and February, but the Workers Center thinks there's enough in this bill, S88, to really work with and organize around as we continue through the elections and through the other side. So hopefully this gave you some creative tactic ideas that although we're small, we think that really on a statewide level with a grassroots organizing drive that it is possible to change the dialogue and really get people kind of thinking in a hopeful way that it is possible if you push your leadership and you rally and you make sure that you don't take no as an answer, that change can happen.